Good morning. My name is Bruno Porras Garcia from the University of Barcelona, and it's a pleasure to share with you these two virtual reality projects that aim to improve treatments on mental health. The ALCO VR project is the first project in Spain aiming to develop a virtual reality Q-exposure therapy for patients diagnosed with alcohol use disorder. This project aims to reduce the contextual alcohol craving and associated anxiety, which usually facilitate alcohol use in daily life situations and also prompt changes in attentional bias patterns toward alcohol-related stimuli. The ALCO project consists of 4 different studies, and each study emphasizes different steps of the project and were completely necessary to conduct the clinical trial. The first study aimed to identify alcohol-related cue and stimuli. Based on this study, the ALCO project designed the 4 VR environment with different characteristics that were applied in the clinical trial. The second study developed a visual attentional task to assess attentional bias, and based on this visual attentional task, it was possible to explore changes in eye movement activity before and after the intervention during the clinical trial. The third study developed and validated the ALCO VR software, and its results showed that the software induced alcohol craving and anxiety responses among alcohol use disorder patients. And finally, the clinical trial aimed to assess the efficacy of the VR Q-exposure therapy approach by using the ALCO VR software and comparing it with a cognitive behavioral therapy in patients diagnosed with alcohol use disorder. So here you can see a video of the different environments, virtual environments of the project. Here you can see also some preliminary results. We need to be extremely careful with these results because we only have 8 patients. But overall, the data indicated a reduction of alcohol craving and anxiety at post-treatment assessment in both groups.